It's 2 a.m., you're not asleep. You're lying there running the same quiet calculation you've been running for years, wondering whether something you do alone, in private, something no one ever taught you was okay, is slowly working against you. Wondering if the body you've lived in for 6, 7 decades is being damaged by a habit you've never once been able to ask your doctor about. Not because you didn't want to, because the silence in that clinic waiting room has always been louder than any question you could form. That silence has a name. It's not modesty, it's not professionalism. It's decades of cultural mythology dressed up as medicine, and it has cost men like you something real, honest information about your own body. So let's end the silence. Right now. You were told this was shameful, maybe not in those words. Maybe it was a look, a lesson, a religious framework you absorbed before you had the language to question it. And for decades, for most of your adult life, you believed it. Or you half believed it, which is its own kind of prison. But here's what that actually means. You've been making decisions about your health based on a cultural story, not a clinical one. And science disagrees with that story. Completely. This is a medical conversation. Your body deserves one. Let's start with what self-pleasure actually does to the aging male body. The biological truth, not the mythology. 1. It reduces prostate cancer risk. A Harvard Medical School study tracking nearly 30,000 men found that those who experienced ejaculation 21 or more times per month showed a 31% lower risk of prostate cancer. Think about that. The act you were taught was a moral failure, maybe one of the most protective things your body can do. Carcinogens that accumulate in prostatic fluid are flushed regularly. This is the part no one tells you. The biology of your own body was quietly working in your favor the entire time. 2. It supports cardiovascular health. During sexual activity, heart rate elevates, blood vessels dilate, circulation increases. For men over 50, maintaining vascular elasticity isn't optional, it's survival arithmetic. The tissue stays elastic. Blood flow increases. The cardiovascular system gets a low-impact workout that asks very little and gives quite a lot. 3. It regulates cortisol. At orgasm, your brain releases oxytocin and endorphins. Cortisol, the chronic stress hormone implicated in everything from inflammation to cognitive decline, drops measurably. In older men, sustained cortisol elevation accelerates cellular aging. This is one of the simplest, most accessible interventions available, and it costs nothing. 4. It maintains erectile function. Here's what that actually means physiologically. Erections are vascular events. Like any vascular pathway, they require regular use to remain patent. Sexual inactivity leads to tissue atrophy and reduced oxygenation of penile tissue. Regular stimulation, with or without a partner, keeps that neural and vascular pathway firing. The men who stop are, unknowingly, accelerating the decline they fear most. 5. It improves sleep quality. Post-orgasm prolactin release acts as a natural sedative. In men whose sleep architecture has shifted with age, lighter sleep, more fragmentation, this hormonal reset can meaningfully deepen the first cycles of sleep. That question you've never said out loud, the answer is, it helps. 6. It relieves pelvic tension. The pelvic floor, the muscular sling supporting the bladder, bowel, and prostate, holds chronic tension in most aging men. Orgasm produces rhythmic, voluntary contractions that release that tension. For men dealing with urinary urgency, pelvic pain, or the muscular tightness that follows prolonged sitting or prostate issues, this isn't trivial. This is physiotherapy. 7. It supports immune function. Research from Wilkes University found measurable increases in immunoglobulin A, a frontline antibody, following sexual activity. Cortisol suppresses immune response. Its reduction, combined with direct immune markers rising, creates a brief but real window of enhanced immune competence. Your body is not your enemy. 8. It improves mood and reduces anxiety. The dopamine and serotonin released during and after orgasm aren't psychological luxuries, they are neurochemical medicine. In older men facing isolation, loss, the grinding attrition of later life, this self-generated neurochemical lift is not nothing. It is something. It is your brain doing exactly what it was designed to do. 9. It maintains hormonal sensitivity. Testosterone receptor sensitivity, not just testosterone levels, determines androgenic health in older men. Regular sexual activity helps maintain receptor responsiveness. The system stays calibrated when it stays in use. 10. It preserves sexual self-knowledge and confidence. And this is the part no one tells you because no one has ever given you permission to consider it. Knowing your own body, its responses, its capacity for pleasure, is not indulgence. It is the foundation of every informed conversation you might ever have with a partner or a physician. It is data. It is self-literacy, and you were never supposed to be ashamed of it. Before we go further, if this conversation is reaching something you've needed for a long time, leave a comment below and tell me. What's the one question about this topic you've never been able to ask anyone? Now, the risks. Because this is medical education, not reassurance theatre, and you deserve the complete picture. 1. Excessive frequency can cause physical irritation. Friction without adequate lubrication causes microabrasion. In older men with thinner, less elastic tissue, recovery takes longer. The fix is simple: appropriate lubrication, reduced frequency if soreness persists. Clinical, not shameful. 2. It can become a compulsive behaviour. When self-pleasure functions as the only available mechanism for emotional regulation, anxiety, loneliness, grief, frequency can escalate past physical comfort or social functioning. This is a behavioural health signal, not a moral one. It points toward what else needs attention, not toward punishment. 3. It can contribute to delayed ejaculation with a partner. Neural desensitization is real. If the stimulation pattern during solo activity differs significantly from partnered sex, the brain's response threshold adjusts. The fix: vary stimulation, reduce grip pressure, allow recovery intervals. A solvable problem, not a sentence. 4. It carries a small cardiovascular risk at very high intensity. For men with existing cardiovascular disease, any vigorous physical exertion carries some risk. This applies equally here. Know your cardiac baseline. If you have unmanaged hypertension or recent cardiac events, discuss exertion limits with your physician. The same physician you've been afraid to ask. Ask anyway. 5. It can interfere with sleep if timed poorly. Post-orgasm arousal patterns vary. Some men experience an energizing dopamine rebound rather than sedation. Tracking your own response and timing accordingly is practical self-knowledge, not rocket science. 6. It can become a substitution for needed connection. Chronic loneliness is a cardiovascular risk factor as significant as smoking. If sexual self-sufficiency becomes a reason to avoid the harder work of intimacy, with a partner, with community, then something important is being lost. The biology is fine. The isolation is the risk. 7. Pornography used as a paired behaviour can distort arousal architecture. Dopaminergic pathways adapt to novelty. Escalating consumption shifts the arousal threshold over time. This is neurological, not moral, but it is worth monitoring, the same way you'd monitor any behaviour that changes what your brain responds to. 8. Guilt itself is a physiological stressor. This is not metaphor. Shame activates the same stress response as physical threat. Cortisol rises, inflammation increases, sleep fragments, immune function dips. The harm in this subject is not primarily biological. The harm has been the shame. Science is on your side. The guilt never was. 9. Physical positioning matters more with age. Joint strain, blood pressure shifts, the simple logistics of an aging body, these are real considerations. Comfort is not weakness. Adapting is intelligence. 10. Ignoring pain or changes is the only true medical risk. Blood in semen, persistent pain, sudden erectile changes, new lumps. These are signals that require medical attention regardless of context. Your body communicates. The physician relationship you've been afraid to have is the one you actually need. So here is your action plan. Not a checklist. An invitation to the first truly informed decision you've ever been given permission to make about this part of your body. Maintain regularity that feels natural, not compulsive. Use appropriate lubrication. Monitor your body's signals without the filter of inherited shame. Schedule the prostate screening you've been putting off. And the next time you're in that clinic, in that waiting room, where the silence has always been louder than your question, ask it. You came into this conversation carrying something you've carried alone for a very long time. A private fear, a thought you've had at 2 a.m. that you never said out loud. The man who lies awake wondering if his body is working against him. That man deserved honest medical information. He deserved it decades ago. He deserves it now. Your body is not your enemy. The silence was,